Today we're going to talk about hand rejuvenation. The hands have now become a real indicator of true aging, where many cosmetic treatments have focused on facial rejuvenation. We now have a much more common request for rejuvenation of the hands. One of the difficult problems to address is the loss of hydration of the skin on the back of the hands. Since the hands are very exposed to sunlight, they're exposed to all the chemicals of washing up and soaps. We recommend a course of Jet Meso, which puts in hyaluronic acid and multivitamins into the skin to help restore that hydrated, nice youthful skin. For patients who want or are suitable for a long-lasting treatment for restoring the volume on the hands, we recommend Acromid, which is an injectable product, gives a very nice, soft, natural appearance to the hands, and that product will last in the hands anywhere from 10 to 15 years. So today we can go and see a treatment in a male patient for restoring the fullness of the hands. This is done in the local anesthetic as an outpatient procedure. We have a 52-year-old patient who's concerned about the loss of fullness of the back of his hands, and you can see the prominence of some of the veins, but the hollowing between the tendons. Now, interestingly, in all the surveys on hand aging, the visibility of tendons is their number one priority. Of varicose veins, sorry, is their number one priority. So if they have very prominent veins, what we recommend is to see our vein specialist, Dr. Netzer, to use steam vein sclerosis to shrink the veins down as a first treatment. Then we address the loss of volume. Remember that the back of the hand always also suffers from all of the skin aging, so the pigmentation problems, the dryness, the thinning of the epidermis and dermis. So in a full hand rejuvenation, we're looking at addressing the skin, the visibility of the veins, and the loss of volume. I'm just going to mark to be able to get access to his hand, Douglas's hand. I'm just going to put a little bit of local anesthetic in two little spots on either side of his wrist, and the same thing on the other side. So we're able to. Douglas, I'm just going to put a little bit of local anesthetic with the cream you had on. It shouldn't be too bad. So just a tiny little bead of local anesthetic into these spots. The product that we're going to use for the back of the hands is Elance S, which is recent development in the Elance range, which was launched at IMCAS in Paris in January this year. Elance is a polycaprolactone, which has been used, which is a compound that's been used in medicine for decades. Elance itself has been on the market since about 2009 with good clinical experience in facial rejuvenation, but now producing a dedicated product for the hands. So cleaning the skin with an alcohol antiseptic, and we're going to use a 27 gauge cannula, which means that there's no risk of puncturing any of the veins, and numerous veins on the back of the hand, and just making a small puncture wound in the skin, being able to inject the product to correct the volume loss. Okay, Douglas, just a little puncture. Feel a little bit of pressure going in, Douglas, but it shouldn't be anything painful. So the cannula slides right in the right plane, which we want to be above the tendons, The veins on the back of the hand are in several layers. There's no single layer that the veins are in. So it's really staying right underneath the skin, and then injecting the product with a linear threading technique, as you would with fat grafting techniques on the back of the hand, which are very popular. But we're going to use this very nice, very soft product, which is just using the fanning technique very, very close to the underneath of the skin, so that we can spread the product where we want it. Good. How are you doing, Douglas? Good. I'm really feeling where we're going, where we're putting the product, making sure that we spread it out. Good. So just make a little puncture wound again. So just adding a bit more to the other side of the hand. And it's a very gentle injection technique. There's no pressure at all. Perfect. So we'll leave that for the moment, and we'll go back to the other side and then come back and have a look and see. Make sure that that's as good as we can get it. On the right hand, we can just gradually deposit the product where we want it. And the great advantage of using the cannula is that it's pretty much pain-free for the patient, and virtually no risk of puncturing the veins as long as you're gentle. If you do it roughly, you can push the cannula through the vessel, but you shouldn't be rough. This is a very gentle procedure, so that there's very little risk of any kind of vascular or venous puncturing. And it's the one thing that we can reassure our patients that they will have a little bit of swelling because of the treatment, but they should have absolutely no bruising at all, because of the cannula doesn't damage any of the little vessels in the back of the hand. So I like to use some antibiotic ointment. I've just made one little puncture further there so I can get between the knuckles, which is a common area where we have the loss of volume, so that where the extensor tendons go over the joints, they become very prominent.
And the antibiotic ointment is really nice to just give the hand a gentle massage and make sure there's no lumps or bumps, smoothens out the product, helps with lymphatic drainage. It's nice patient contact.